I do have right at 6 o'clock, and I don't have anybody else joining right now. The participants seem to be staying pretty steady. So I'm going to go ahead and get started. I figured there wouldn't, like I said earlier, I figured there wouldn't be a ton of people joining us as it's an evening presentation before a holiday, with it being Veterans Day tomorrow. Thank you to any veterans who are on the call or family members of veterans who are on the call. But we will move forward. Hopefully it'd probably be a pretty quick presentation. There's not a lot of real new stuff, but we still want to do our evening presentation for folks who have trouble getting to the presentations during the day. So my name is Brian Dowd. I'm the Deputy Executive Director over Policy Operation and Compliance here at the Department of Community Health. And I want to thank everybody once again for joining us and continuing to be engaged, because it does help to make the federal mandate of electronic visit verification a usable thing for our members and our providers. We start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're just going to do some brief project updates. We're going to do some common issues or questions. We're going to run through some of the common issues we're seeing. Then we're going to turn it over, I'm very excited, to a provider, to hear from a provider who has been using the system, so you don't have to hear from me for the whole presentation, which I'm excited about, and I'm guessing you guys are probably excited about too. We'll do our third-party vendor update, and then we'll take any Q&A that you might have. So where are we in the timeline as far as our project update? Effective November 1st, we required via policy that all providers and members are submitting their claims through the EVV solution. Now that may be a third-party EVV solution, or that may be directly utilizing the NetSmart solution. But either way, we expect all claims to be coming through, and it is a policy mandate as of November 1st, 2021. Now, there are some exceptions to that rule. And those exceptions are if you have a member who has a cost share or a patient liability. This is specific to our CCSP and SOURCE programs. So I've done some checking. There is no one with a cost share in NOW, COMP, or ICWP. Cost share only exists in CCSP and SOURCE. And that is where members actually have to pay a portion of the money they receive in retirement or disability or Social Security towards their own care in order to receive Medicaid. And in those programs, if you have members with a cost share, you can continue to bill through GAMAS. If you have shared services codes, and we'll go over what those codes are on the next slide in just a minute, you can continue to bill through GAMAS. If you have called the NetSmart call center, the conduit call center actually, and you have an open tier 2 ticket, you can continue to bill through GAMAS. And you would very probably rightfully say, well, Brian, what's a tier 2 ticket? A tier 2 ticket is something that the call center cannot resolve right away. They cannot say, well, we can tell you how to fix that. Here's the training manual to do it. Or they can't walk you through an example and say, if you click here, click here, click here, it gets fixed. Or they can't directly instruct you what needs to be done to get fixed. If they have to escalate it to the NetSmart team to do programming, to fix something in the system, they will give you a tier 2 ticket, and you are welcome to bill those claims through GAMAS as well. If you have questions or concerns about these exceptions, for now, we still do have the EVV Medicaid mailbox open that many of you utilize. It's down here on the bottom of this slide. And again, this slide will be publicly available on our website. There's other PowerPoint presentations on our website. You can go in and get that email off of there as well. So lots of places you can pick up that email. So there's no need for you to take a screenshot or try and furiously write anything down. So these are the shared services code. They are all T2025, U4 or U5, and they have different modifier combinations for if it's the basic community living supports for traditional providers, or self-directed. We actually don't have any co-services employer individuals at the moment. So the grade ones actually, they're not really relevant unless you were to get one of those. But this is community living support, so it is specific to the NOW and comp waivers. It is not in ICWP, CCSP, or SOURCE. It is only for NOW and comp, and only if you have shared services and are utilizing this code. This would be one of your caregivers that is working simultaneously for 2 or more members at one time. Case management, where are we with case management? We do expect the functionality to go live in the system tomorrow. So it's not there yet, and we don't have communications out yet because we want to make sure that everything's up and running good. But once it is, starting next week, we will have some communications to go out to you guys, including a checklist on the EVV provider page that provides information. The case management functionality will be a great tool for case managers to use in their toolbox, but case managers will continue to bill as they always have through the GAMIS system, because case management is not a mandate by the federal government like personal supports and community living supports is. This is an added benefit that we're doing to the EVV system. So let's talk about some common issues and questions. There were many concerns about the rate, the temporary Appendix K rate adjustment for NOW and comp not showing up in the EVV system. That has since been fixed. So you should see the new rate. Now, if you have an unmatched claim, that rate should have already updated, because those continue to match every hour, to attempt to match every hour for an unmatched claim. But if you have a matched claim and you need to get that new rate to show up, you can actually click on rematch and it will update the rate for you. If you have any questions about that Appendix K temporary rate increase, then you can contact the call center or use the EVV mailbox to talk about it and ask your questions, and we'll be happy to respond. This rate increase is specific to the Appendix K. Many of you guys have asked me about other proposed rate increase associated with waiver renewals and the American Recovery Plan Act. None of those rate increases have been approved by CMS at this point, so they are not available in the EVV system or the GAMIS system at this point. We will, of course, do all of our normal communication if any other rate adjustments are received for approval, including banner messages, email blasts, everything we normally do to providers so that they can get that information. Also, if you continue to see missing members or missing prior authorizations, please contact the call center. Now, before you contact the call center, make sure that missing member and PA is in the system, the GAMIS system. I get a tremendous number of these calls and concerns about missing members and missing prior authorizations. And about 75 to 80% of the time, the problem is the member's not in GAMIS, or the member is in GAMIS, but they're with a different provider agency and their prior authorization hasn't been updated. So just make sure before you call the EVV system that everything is correct in the GAMIS system first. Billing related issues. You really need to look at what your service units are and what's available inside of GAMIS. A lot of folks are calling with some current concerns about, hey, EVV system says I have 56% of PA units left, but GAMIS says something different. GAMIS is the system of truth. And while we've been allowing you to bill both in EVV and GAMIS, sometimes you're billing in GAMIS and EVV doesn't know that you're billing in GAMIS. So GAMIS is subtracting the units, but EVV isn't, because you haven't put those claims through EVV. So GAMIS is your source of truth. You didn't get any new units because of EVV. So you should not be exceeding what is on your plan of care as reflected in the Georgia Medicaid Management Information System. We've also received some calls and concerns saying, hey, GPS isn't working right. So there's multiple ways that we can actually look at GPS and the functionality of a GPS system. But if you think you're having issues with calibration, make sure that you call the call center and we will make sure that that aide's phone is appropriately calibrated. But we can do we have some fancy behind the scenes stuff we can do as well to check and make sure that GPS is actually working correct. Another really important thing that we need to let you guys know about is that the claim submission deadline has moved. I've gotten a fair number of concerns about, hey, I billed on Friday and I'm not seeing any of my money. That's true, because the cutoff for claims submission moved up by 12 hours, a half a day, from Friday at noon to Thursday at midnight. So make sure you get all your claims from Friday to Thursday submitted by midnight and released through the system so you can get those claims paid and on your payroll on the end of the week's run cycle. Now, it's important to know your RA has not changed. The date we're depositing money into your account has not changed. All the normal processing that GAMUS does in the background is still the normal processing. Nothing has changed about that other than the deadline has moved up by 12 hours. Rounding rules. We get a lot of questions still about rounding rules. So we did implement guidance on the rounding rules, which is 8 minutes or more, you round up. Less than 8 minutes, you round down. And this was at the request of you all as providers that said, hey, we need some rounding rules because my aides are working 1-2 minutes over and it's rounding up to the next 15-minute unit. And my members are really concerned that they're not getting enough bang for their buck. They're not getting enough service out of their units. Totally understandable. So we did release guidance associated with the rounding rules, and we implemented that in the NetSmart system. So again, if you have questions about the rounding rules, you can feel free to email the email box and we'll be happy to answer them. There is one program where they bill hourly, and that's ICWP. In ICWP, the rounding rules are less than 30 minutes rounds down, more than 30 minutes rounds up. Duplicate claims editing. We're getting a fair number of these too. So I'm not talking about scheduling conflicts where I may work for Mr. and Miss Smith in the same house and I'm done with Mrs. Smith at 4 and I want to start Mr. Smith at 4 o'clock. We are trying to adjust the system for that. Right now, there needs to be a 5-minute break in between the two. So we're working on that right now in order to make sure that you can do right at 4 on to 4. But what we're seeing also a fair number of is this. Brian Dowd is working for Mrs. Smith at location A at 4. I'm clocking in with Mr. Jones in another location at 3 with a different company. Now I can't be in 2 places at the same time. I can't be in Mrs. Jones' house and Mr. Smith's house at the same time. Likewise, we're seeing aides that are clocking out at Mrs. Smith's house and then clocking in for Mr. Jones, who lives 7 miles away, as soon as they're clocking out of Mrs. Smith's house. There's no way you can move 5 miles immediately after clocking out unless you have a teleporter, right? There has to be some sort of time break there for you to get the 5 or 6 miles between Mr. Smith and Mrs. Jones's house, or vice versa. I think I messed up the nomenclature there. But between the 2 service locations, you are going to have to travel, and that should be reflected in your clock in and clock out. Remember, we don't pay for travel time. We do actually pay for travel time. It's built into your existing rate. So the existing rate structure is inclusive of travel. So when you're clocking in and clocking out, you wouldn't clock in extra time for that. Let me also stop here because I got a question today from a provider, and I got the same question 3 times so far in the last 2 weeks. And the question is this: my aide shows up at the person's house. The person that I'm serving, the Medicaid member, is in the hospital. And I've been asked, how do I bill for an hour given that the provider, the member has gone to the member's house, the aide has gone to the person's house. You can't do that. That's not allowed. We only bill for when services are rendered. It's unfortunate that you didn't know about that member being in the hospital before they went. And yes, do I think it's fair that the person drove to the member's house and they can't, bill for anything? No, it's not fair, but it is part of the cost of doing business. You guys may not know this, but we don't even allow doctors in Medicaid to bill for missed visits. It's just part of the fact that how tax dollars work and the coding for tax dollars work. So we have to actually pay for services. We can't pay for missing visits or time and effort for missing visits. We can only pay for actual services rendered. That's just part of the Code of Federal Regulations and laws for accepting tax dollars. Okay, I'm gonna pause here because this is the exciting part where you don't have to listen to me for a while. I'm gonna introduce Mr. Sam Dalaman, who's the administrator with Omega Healthcare in Atlanta. Take it away.
Okay, can you hear me?
We can hear you great, thanks.
Okay, yes, thank you, Mr. Brian Down. Yeah, Omega, we use a third-party EVV vendor called Matrix Care. The reason we pick Matrix Care because we already been using them for like several years prior to the EVV mandate, to manage our database, to manage our client and caregiver records. So when we got a notification about the EVV mandate, so we didn't waste any time at all. So we jumped on right away. So actually we started approximately 2 months prior to the first claim submission on the July 1st. So we were conducting meeting on a weekly basis with Matrix Care with the integration. There's a lot of problem at the beginning. I believe we were the first one in Georgia to be integrated with Matrix Care. And then we got through that, and all the caregiver schedule and the management of clock in, clock out activity were done to Matrix Care. And then likewise for the invoices, all created from the Matrix Care, and we submitted them on a weekly basis, which upload automatically to NetSmart system. All the claims issues were resolved through the NetSmart system, the call center. So we utilized it for quite a few times. So everything was kind of moving along since then. So our success, or actually the tips and tricks that we, get to where we are now. So like I said, we started very early, and we train our caregiver every day in small group of 5 to 10 for like 2 months straight, every day, including weekends sometimes. So sometimes we have to train them over and over again just to make sure that they get it. Some of the issues that we had at the beginning with the claim, actually we started submitting all our claims since July 1. So we cut off all of our paper timesheet July 1. We were submitting everything through the Matrix Care, through the GAMUS. But on July 1, everything got cut off. We submitted everything to NetSmart for a while, for at least 3 weeks. Nothing was going through the NetSmart, to the GAMUS. So we had to kind of like, on a phone call with Matrix Care, on a phone call with NetSmart's system. So we finally got through, and then later on we had a PA not found issue along with the PA missing. So those we got resolved as well. And some of the issues that we had involved some of the pushback and complaint from our caregivers, because we got quite a few people that work for other agencies that did not get on board with EVV at the same time. So we got a lot of pushback because of that. But we overcame all those problems. And today, we've been successfully submitting all the claim and doing all the EVV very, very smoothly since October 1. So I'm really, really happy for that.
Thank you so much for that information and for joining us yesterday and tonight. I think it's really important to hear kind of the lift you had to do, because it seems like it was significant, but that you've gotten to a successful point. I do want to let folks know that this is not us advertising any one particular third party. We just really appreciate Mr. Dalaman coming on to helping us, with his perspective. Sometimes we think it's good to hear from a provider rather than just me. So thank you again, sir.
You're welcome.
Great. So I also want to do a little bit of a third party update for you guys, because that's really an important thing. So as you can see, this list of providers has grown. And the Matrix Care we just talked about is one of them on here, but there are 34 options to use that are fully integrated with EVV at this point, including the free Georgia sponsored system, which is NetSmart, which is that EVV system for the state of Georgia that is at no cost. But if you don't want to use that no-cost solution and you want to go out because you're familiar or whatever else with another solution, you have 33 other options in the state of Georgia to pick from. I think that, I'm sure that is more option than any other state, at least any other state that I have spoken to. There are states out there that mandate one system. There are states that have 10 systems and they tell you got to go out and pick from one of these 10 and pay for it yourself. In this state, we kind of gave you the best of both worlds. We give you a free option that we sponsor, but you can also pick from all the rest of these solutions. In addition, we continue to work with another 9 companies in addition to those 34. And we're very confident that we should be able to integrate with this group soon, but we haven't gotten there at this point. These folks are folks that either have told us, hey, we don't have clients in Georgia, or we're not really going to be able to integrate with you. So if you do have these folks and you're using these folks, make sure that you have a plan for full integration as well. Okay, I want to pause here just to make sure that you guys know that this is the EVV call center number, 833-701-0012, and this is their email, gaevvsupport@conduit.com. We do have somebody who monitors, DCH staff member, a lawyer of mine, who monitors. She works in my team. She's one of the team members. We actually work together. She monitors the call center. So she's looking at tickets, she's looking at customer service, she's looking at all the metrics that are in the call center regularly. So we are actively monitoring the call center at all time. It's also important to note we're getting about half calls, half emails. So it just shows you how the world has changed. People are much more comfortable electronically than they are with calls. So please start your concerns, your questions with the call center. And then if something needs to be escalated, you can always use the EVV mailbox or my own personal mailbox. Or if it's more of a policy question, you can send it to me or the mailbox. But know that if it's, hey, I'm missing a provider, I'm missing a PA, I'm just going to forward that to the call center. I'm not going to fix that myself. That's not something I'm going to fix. It takes the call center to fix that. And it's important that we send it to the call center because they're the ones that open that tier 2 ticket if necessary, allowing you to continue to bill through GAMUS. So that's why it's really important that you start with the call center. Okay, let's see what questions we have. So is Acumen exempt from rounding rules? That's a really great question. Thank you for asking. So it isn't a mandate that DCI uses rounding rules. We did not mandate with the fiscal intermediaries that they use rounding rules, but we will certainly speak. We have regular meetings with both Acumen and Continuum, and we will speak with them about adopting rounding rules. I do think it's an important step, so allow us some time between now and a couple of weeks, and we will follow back up with those fiscal intermediaries about that. What is an activity code? Some of my staff gets this when clocking out and can't sign out without code. I'm not quite sure. Is that the task code that you have to have? I'm wondering if Lindsay is on. I tell you what, we'll take that back and make sure we write you directly about it, and we'll include it in our FAQs. Next question is, didn't the state legislature and DCH board approve a 10% rate increase for ICWP? I can't remember what went in front of the board and who got a 10% rate increase. I believe there was a 10% rate increase for EDWP, which is Source and CCSP and ICWP. But just so you know, 2/3 of the money comes from the federal government and not the state legislature. So we can't approve anything until CMS says we can approve it. So that is correct. We have to wait on CMS for any approval, since the vast majority of the money for Medicaid comes from federal tax dollar and not state tax dollars. We tried that, didn't work. I don't know what that is, so you may want to send me that in a message to me. I know you've sent several emails, so feel free to send that to the EVV mailbox. You have two clients who you can't bill through TELUS. One says verify electronically, the other says diagnosis code isn't right. And I've called multiple times. They say it's a GAMUS issue. Need to know what next steps are. Well, for right now, you can bill through GAMUS, since you should have a tier 2 ticket open. We monitor all tier 2 tickets, and we will follow up with you as soon as we can get that tier 2 ticket resolved. So for right now, your next step should be to bill through GAMUS, and then we reach back out to folks to tell when their issues are resolved. I'm going to follow up as part of this meeting for can't verify electronically. That's not a GAMUS issue. That would be a TELUS issue. The diagnosis code, there may be a mismatch between GAMUS and TELUS, and that's something we have to manually go in and look at. If a provider is using a unspecified codes, those are not allowed in the GAMUS system for billing. Okay, that seems to be all the questions for today. But one question. If you use a third party, can you receive a tier? Yeah, you can still get a tier 2 ticket with a third party, or a tier 3 ticket through a third party. The question is your third party going to bill through GAMUS? But yeah, you can still get a ticket if there is a system issue and still be allowed to bill through GAMUS. Absolutely. Okay, that's the end of the questions. I want to thank everybody for joining me today and for your continued participation. I want to thank Mr. Dalamon, I'm sorry, again for his participation the last 2 days. It has been very, very helpful. And we really appreciate all your work in this arena. It has been very helpful for us in a learning curve. Everybody out there, please keep participating, keep giving us your questions and concerns. Thank you. Have a good night and have a good Veterans Day holiday tomorrow.